Hi, good evening. My name is Suzanne Powers, and I am a pediatrician at Reston Town Center Pediatrics. I came to speak about the calendar and 5-day-a-week in-person learning for our children. I came in person tonight because I believe it's the most effective way to get my point across. Don't get me wrong, technology has been a godsend for us. We have tried, as we have tried to mitigate the risks of COVID-19, however, it has limitations. I applaud the board's recent decision to go back to 5-day-a-week in-person learning in the fall. However, I am worried about the children across the county who are currently experiencing unprecedented increases in depression, anxiety, ADHD, addiction, suicide attempts, obesity, eating disorders, child abuse, parental stress, food and housing insecurity, and behavioral problems. These children need our help now. I believe one of the best ways to help them is to get them back to full-time in-person learning as soon as possible. Schools not only play a role in the education of our children, they are essential for our child's socialization. They give a child a safe place to learn, and they may supply the only food the child eats that day. Since the pandemic started, I have been confronted with depressed and anxious children as young as 7 and 8 years of age. I have become intimately familiar with a questionnaire called the ASQ. That's the Ask Suicide Screening Questions. I now routinely see 1 to 3 patients a day with a mental health concern. And I have personally had 3 of my own patients admitted to the hospital for suicidal ideation or attempts in 2021. This is unprecedented in my 20-year pediatric career. And while I'm working with the patients and their families to get these children the help they need, the counseling and the appropriate medications, I can't do it alone. I'm not going to bore you with the numbers, but I wish to reiterate several points that make school reopening safe. Masking is an effective, extremely effective means of decreasing transmission. As a frontline medical provider, my office has remained open throughout the pandemic, and we have had 0 cases of COVID transmission, despite having many patients test positive for the virus, and being in close contact with them, essentially zero feet apart when I examine them. With strict adherence to masking, the 3 feet of social distancing in schools is safe and based on clinical evidence, and should be recommended if 6 feet is not achievable due to space restrictions. Schools have not been found to be super spreader locations. In fact, studies have shown most schools that have returned to in-person learning have had significant lower rates of transmission than their surrounding communities. Given the overwhelming evidence that children are being harmed by schools not being open full-time, and the overwhelming evidence that school reopening is safe for teachers, staff, and students, I urge that preparations are made for the immediate reopening of full-time in-person learning in Fairfax County. Thank you for this opportunity to speak.